All right. Well, thank you all for joining us here today. My name is Taylor Gage. I'm Director of Strategic Communications for Governor Ricketts. In just a moment, Governor Ricketts will kick us here off, but I wanted to introduce our two guests for the day, which are Dr. Gary Antone, who's the state's Chief Medical Officer, who's going to be talking about some of the treatments that have come into use for coronavirus, as well as Craig Bisher, who's joined us here today to share his coronavirus story. Per our usual tradition, we will start with questions that have been submitted ahead of time, and then questions from here in the room. And if you're broadcasting, please keep sharing your shot throughout the program. And with that, I will turn it over to the governor.
Great. Thank you very much, Taylor. I appreciate it. Thank you all for joining us for this press briefing on the state's response to the pandemic. As Taylor mentioned, we've got a couple of guests today, but before we get to the guests, I want to remind everybody to continue to use the good habits we learned last spring with regard to how to slow the spread of the virus. It starts with making sure that you're trying to keep that 6 foot of distance between you and other people when you're out in public, wearing a mask when you cannot do that. So if you're going to be inside a store, wear a mask. If you're going to be in any sort of business where you're going to be closer to the staff than 6 feet, great opportunity to wear a mask and required under the DHM if it's going to be for more than 15 minutes. Also, make sure you're washing your hands often. That will actually kill the virus. Please make sure that you're staying home when you're sick, because even if you haven't tested positive for coronavirus, if you've got symptoms, you may have it. We know that some of this is spread through people who maybe don't have very mild symptoms, but say, just got sinuses or something, so I'm going to go out. Well, please make sure that if you're sick, you stay home. It's important that we slow the spread of the virus here. Also, want to make sure that folks are going to the store once a week, shopping by themselves. All those things will help us make sure that we slow down the spread of the virus. Additionally, we've talked about avoiding the 3 C's. Those are crowded places, close contact, and confined spaces. It's a virus that spreads from one person to another. So if you avoid those places, you'll reduce the chance for the virus to spread. And again, all of this has been around making sure we preserve our hospital capacity. And we've seen a tremendous increase in the number of hospitalizations over the course of the last several weeks. On September 23rd, a little over 2 months ago, we had 200 people in the hospital. Today, we've got 938 people in the hospital as of last night. So we need to make sure that we're preserving that hospital capacity. We need everybody's help in slowing down the hospitalizations, slowing down the cases by using the tools that we have, following our rules, and making sure that we're doing a good job of slowing down the spread of the virus overall. Another way to do that is through Test Nebraska. You go to the Test Nebraska site, testnebraska.com, fill out a profile. We've had over 500,000 Nebraskans do that. And then you can sign up for a test. We've delivered over 422,000 tests. Last week, we actually got asked a question, or actually earlier this week, about have we seen Test Nebraska doing more tests? And the answer is yes. We didn't have the data off the cuff at that press briefing, but I brought it today, that if you look over the last 3 weeks, for the week that ended October 31st, we did 2,923 tests on average across that week. For the week ending November 7th, we did 3,237 tests. And for the week that ended November 14th, we did 3,612 tests. So we saw increasing tests over the course of the last 3 weeks. And during that last week, we reached a high on Wednesday of last week of 5,300 tests a day. And of course, then the average, obviously, other days are down lower. So that brings that overall average down to that 3,600 number I gave you. So we are seeing with the increased scheduling available at Test Nebraska, increasing tests that go along with it. So again, please take advantage of Test Nebraska. Obviously, if you want to go see your grandmother, it's a great way to go get tested. Make sure you don't have the virus, that sort of thing. And that will help us make sure we slow down the spread of the virus as well. And of course, if you do get contacted by our contact tracers, please, first of all, treat them with respect and treat them gracefully. They've got a tough job, and they are just trying to help make sure we keep everybody healthy here. So, and follow the rules. So if you are tested positive, we need you to isolate. If you have a close contact, such as I had a week and a half ago, then you have to quarantine. And you cannot test out of quarantine. You're in quarantine for 14 days. So again, please follow the direction of our contact tracers. Leave a little space for grace. Be nice to them. Be respectful. That's who we are as Nebraskans. So we want to make sure that we're doing that for our contact tracers and for our local public health people as well. So please treat them that way as well. So next, we're going to get on to our testimonials. We've had several people come in here talking about their experience with coronavirus. Many people will have mild symptoms or some no symptoms at all when they get infected with coronavirus. However, some people will be severely impacted, and some people will even die of coronavirus. And that's what we're looking to avoid, is to be able to slow down the spread, make sure we're preserving our hospital capacity and so forth. And so Craig Bisher, who is a team member of the University of Nebraska Foundation, had a scare with coronavirus earlier this year, and he is here to tell us a little bit about his experience. And again, to remind people that this can be very serious for some people who get it. So that's why we're taking all these precautions to slow down the spread of the virus. You may know somebody who had the virus and did very well, but I want to remind you that if you pass it on to somebody who has a difficult time with it, it can be very difficult. So with that, Craig, I'm going to ask you to come up and talk a little about your experience with the coronavirus.
Well, thank you, Governor. It's a pleasure for me to be here and tell you a little bit about my story. As the Governor mentioned, it was earlier this year, it was actually 2 months ago that I was diagnosed with COVID. I had some symptoms prior to the diagnosis that was my legs were kind of weak, and I was tired all the time, and went to my doctor, and I didn't have any other symptoms, and he said, well, let's see how this plays out over the weekend. This was Friday, and he said, you come back Monday. We don't like to test unless we know for sure there's a real good chance you probably got it. So anyway, I went back that weekend. Was a kind of a tough weekend. I got the other symptoms of the high temperature, the limited breathing, but it wasn't bad yet. And so I went back Monday. He did the quick test, and I had it. COVID, so he gave me some medication, and he said, now as soon as your blood level in your oxygen level in your blood, if you can't keep it above 90, then you go straight to the ER. I did fine from Monday till Friday morning. Friday morning I tested 3 times, and it was about 87, and so we went into the ER. My wife took me in. They got a room ready for me, and as the Governor had mentioned, there was back the 25th of September, I didn't realize there's that many more in the hospital now. There was just a shade over 200 at that time, and now there's 900 and some. So I feel very fortunate that I was able to get in and get a place on the COVID floor there. Well, anyway, I spent 9 days in the hospital. Had the main problem was breathing. With limited on breathing, I'd walk around the room, get winded very easily. My legs, I had to make sure I hung on to something. And so that being said, I'm giving you a little history of what my experience was, because prior to my getting COVID, I'll have to be honest, I didn't necessarily take it real serious. I wore the mask most of the time. I went ahead and felt that I was probably healthy enough that I could lick it. It won't be more than a cold, because some people had those symptoms and got by real well. After getting COVID, I'll tell you emphatically that it's something that made me a believer. So we all need to make sure that we can do things that will help the spread. What can you do? The Governor has mentioned this over and over, and many other people have too. You've got the 3 C's on my right here. You've got to wear a mask. You've got social distancing. But one of the things that I would like to emphasize is to plan ahead. For instance, we've got a holiday coming up at Thanksgiving that I don't know about many of you, but this has been a tradition of our family to get together at Thanksgiving, and we have a great time. We've got a daughter in Chicago, and the rest are in Nebraska, but they still come in from distances. And it's going to be tough not getting together for Thanksgiving. And we've chose not to do that so that we don't take the chance of somebody picking it up or somebody transmitting it and then going back out. Is it going to be inconvenient? Yes, but we've got social media, either FaceTime or Zoom, that we can go ahead and make the best of it. Is this something we're going to do every year? No, we've got to do it this year so that we have the capabilities of getting back on track next year. Just like the football team, you know, they had to delay their season. I'm in hopes that I can go back and watch football next fall, but we've got to be responsible for what we're doing right now. And I want to emphasize, too, I'd like to put a plug in for everybody doing it voluntarily. I myself don't like mandates, so if we can go ahead and have everybody say, you know what, it's inconvenient to wear a mask, and maybe I'm kind of cooped up, but let's find ways that we can go ahead and voluntarily do things to prevent the spread of the COVID. The other one is Christmas. Many of the families love Christmas. They love Santa Claus. I did a little bit of research and found out there's a virtual Santa Claus that you can get. Come on Zoom. There's a drive-by Santa. Having kids sit on Santa's lap is not going to be recommended and or even offered, as far as I'm concerned. So these are things that we all need to be aware of and make sure that we have the things in place to help us not spread the virus. And now in closing, let me take off my glasses, and you'll probably notice I got a pretty good shiner here on my left eye. I mentioned this to Taylor on the way in. I didn't know if this is going to be a distraction or not, but it actually plays into my COVID story, because when I had COVID, I had a blood clot in my leg. They put me on blood thinners. Well, I bumped my head last Thursday, and it didn't do anything more than a pretty good little bump, and it hurt a little bit. But as time went on, my blood was so thin, it kind of filled that eye socket up. I'm fine. It doesn't hurt, but it is a visual sign of COVID, because as we know, COVID is invisible. You know, we walk around, we don't know who's had it, we don't know who could be a spreader. That's the reason we all need to be very responsible, and I hope that my testimony can encourage others to take this serious so we can get through this epidemic. Thank you.
Great. Thanks very much, Craig. Appreciate you coming in and sharing your story. And appreciate you also talking about your Thanksgiving plans, because that's something that every Nebraska family should be thinking about. My family's going to be similar. Normally we get together and there'll be a whole bunch of us, but we're going to do it in individual family groups. It's going to cut down the size of those gatherings to slow down the spread of the virus. So we're really asking all Nebraska families to consider the same, that as you look at the holidays, it's going to have to be different this year with the virus. So please help us slow the spread of the virus by not having that big Thanksgiving get-together that you might normally have. But think about breaking up into smaller family groups. Our family is going to be staying connected through Zoom. That's a great alternative for folks to be able to still see the relatives, but do it in a way that's going to help us slow the spread of the virus. And certainly if you've got members of your family who may be at higher risk, again, people are going to be older with those underlying healthcare conditions, you want to make sure you're taking care of them as well. Now, one of the things that we've seen through this pandemic is that our doctors and nurses have done a fantastic job of taking care of people who have the virus. And to be able to talk about some of the improved treatments that we've got for coronavirus, I've asked Dr. Antone to really come up and highlight some of those things. Certainly, we've gotten some very good news this week with the Moderna vaccine being announced that it's 95% effective. And about the week before, we had Pfizer talking about how their vaccine had been tested at over 90% effective. These are all good news steps. However, it will take a number of months before those vaccines are widely available to the general public. As we distribute those vaccines, they will go first to our priority groups, such as healthcare workers, long-term care workers, first responders, people who are going to be more vulnerable, the elderly, especially folks who are going to be having those underlying healthcare conditions and so forth, minorities. All these groups are going to be our priorities as we distribute this. So we are going to need to continue to be able to slow the spread of the virus until we have wide distribution of that vaccine to be able to help take care of people. And when it comes to, again, taking care of people, that's what our great doctors and nurses in the state have been doing. And so, Dr. Antone, I'm going to turn it over to you to talk a little bit about the great work that's been going on with regard to treatments.
Thank you, Governor, and thank you, Craig. What a great job. And you reminded me of adding on to this talk that I'll be giving right now, that even though it's not a direct treatment for COVID. It is something that more and more physicians and healthcare providers are using, and that's medication to try to keep your blood from clotting, the anticoagulation medication. And they're not only using it in a little bit higher doses than what they would normally use for a patient that just regularly comes into the hospital, but even maybe up to a therapeutic dose to really keep your blood from clotting, and then also maybe even discharging patients on that medication also. So I'm going to start with the slides, Ryan, if we can, and just go over the common treatments now that are used for COVID. And I'm going to start with the medication Remdezavir, which we've all heard about and talked a lot about. This Remdezavir is an antiviral medication that inhibits an enzyme called RNA polymerase. COVID-19 is an RNA virus, and so this does slow down the replication of the virus. Remdezavir was actually first used for viruses like Ebola, and for that reason, the University of Nebraska Medical Center took place in a lot of the early trials for COVID. And actually, Dr. Khalil from the University of Nebraska Medical Center was one of the lead investigators on using Remdezavir in the COVID patients. It was the first treatment for COVID-19 approved by the FDA. It was approved back in February under emergency use authorization. And since that time, it was allocated to the states as far as how you could get it to the hospitals, but right now it's widely available for purchase by any hospital system. In the largest studies on Remdezavir, it showed that it significantly reduced the time for a patient to recover in the hospital from 15 days down to 10 days. And in that same study, there was a trend, but not a significant reduction in mortality. So it trended towards a statistical significance, but did not quite reach statistical significance for decreasing mortality. We've also learned since February or March of this year that we used to use Remdezavir only in the later stages of the course of the illness, like when patients were already really gravely ill and on a ventilator, but now it's used very early in the course of the illness, even as soon as a patient is found to need oxygen therapy, they'll start Remdezavir treatment. So the next one is medication is called dexamethasone. It's a steroid medication, and what steroids do is they modulate your own body's inflammatory response. So rather than basically attacking the virus itself, what dexamethasone does, your own body's response to the virus is to create these cytokines and these proteins that actually try to kill the virus, but at the same time can do damage to your own tissue, your own lung tissue. And so dexamethasone tries to prevent that hyperimmune or that immune response that your body might make that it's doing to try to kill or slow down the virus, but actually also doing damage to your own tissues. So the dexamethasone has been shown to help with that. And a
Ryan, I
largest,
think you need to advance the slide.
pardon me?
Ryan needs to advance the slide, I think.
Oh, we have it up here, Governor. It is on the screen.
Okay.
Yes. Thank you, though. So in the largest trial on dexamethasone was done in the United Kingdom. It was called the Recovery Trial. It demonstrated a very significant decrease in mortality by 35% in patients that were on ventilators and decreased mortality by 20% in patients that required oxygen. Again, just like Remdezavir, it's been learned that once a patient requires any form of oxygen, supplemental oxygen therapy, that dexamethasone is usually started at that time rather than waiting towards the end of the illness. It has not been shown to be of any benefit to patients that do not require oxygen, so it's generally not used as a prophylactic medication for that reason. The next treatment, and one that was used and still used to some extent, is called convalescent plasma. Convalescent plasma is what's known as polyclonal multiple antibodies that are now started to be used in August of this year for patients with severe and life-threatening infections. It's basically the plasma of a patient's donated blood that has already had COVID-19 and therefore developed antibodies towards COVID-19, therefore giving those antibodies directly to the patient who's ill. Now, this is called polyclonal because it contains multiple antibodies that that person or that patient that had COVID developed against the virus, but also gives other antibodies that that patient maybe developed with other viral illnesses in the past. So this is something that was used quite extensively and actually led to the development of the next treatment, which are called monoclonal antibodies, as the governor mentioned. This is the newest form of treatment, and a monoclonal antibody is a protein or an antibody that's actually made in the laboratory to specifically target what they call the spike protein that allows the virus to attach to your own cells. It attacks that part of the virus and then destroys the virus. So it obviously prevents the progression of the disease. Again, they've been found, and the studies show now that it's mainly given to patients on an outpatient basis to try to prevent that patient from getting ill enough to come into the hospital. So it's given right after a patient tests positive. Within the first 7 or 10 days, it's been shown to be effective to keep that patient from developing an illness to be severe enough to be hospitalized. So it's given in an IV infusion. It will be actually given in long-term care facilities, in infusion centers, and maybe some other areas where patients can come in and get this IV infusion. It lasts about an hour. Usually you need to stay another 2 hours just to sort of watch to see if they develop any side effects. But it was just authorized November 9th, and already it's being distributed. The state is responsible for allocating this, just like Remdezavir was at first. And we will be getting out our first shipment here within the next 7 days or so. So the early evidence for the monoclonal antibodies showed this to be of benefit in the outpatient setting, where it could possibly reduce hospitalization for that patient by 5 to 10%. So let's say you had 100 patients that you gave the monoclonal antibody infusion to. Hopefully it could prevent 5 to 10 of those patients from eventually ending up needing hospitalization, which would be a great thing to have at this point. And just the last thing I want to mention is about vitamin D. There's been a lot of talk about vitamin D and what vitamin D does. It also, just like the dexamethasone, it helps to modulate your inflammatory response. The studies showed that in patients that had COVID and needed ventilator therapy or ICU therapy, that patients generally had a higher risk of having a low level of vitamin D in that setting. And patients that didn't had a less of a need for ventilator therapy or basically ICU care. But what they found is that that vitamin D level needs to be up in the normal range even before you come into the hospital. So it's something that they're now saying it's probably best used right now as we're all standing here to be taking now. The actual recommended dose for vitamin D is 400 international units, but most people are recommending up to 4,000 to 5,000 international units now on a daily basis for vitamin D to get your levels built back up to normal. This is specifically important in our area of the globe because in the wintertime, the sunlight turns the inactive form of vitamin D into the active form. And now when we're in our winter period, that ultraviolet light that does that is not strong enough to convert that vitamin D inactive form into the active form. So it's very good to supplement it by taking that oral dose. So I'm going to end that here, Governor, and turn it back to you.
Great. Thank you very much, Dr. Antone. Appreciate the help with that and covering the advanced treatments that are being used right now to help people in the hospital. So appreciate that summary. And again, what we really want folks to do is to continue to make sure that you're following all of our good rules to be able to slow the spread of the virus, to help out our hospital capacity, to assist our healthcare workers, and make sure that we're keeping people out of the hospital by slowing down the spread of the virus. Now, on Friday, I had announced that we have a threshold where we will have further restrictions. That's when we reach the red zone. It'll be based on a 14-day rolling average of our hospital capacity. And when we reach 25% of that hospital capacity filled with coronavirus patients. Ryan, can you put up the slide for that is updated for today, please? What this slide shows is the 938 hospitalizations that we have today. The orange line, right, that's running, really bisecting our current cases is the orange level that we are in right now with our current restrictions. And if we continue to see hospitalizations rise, we will hit that red zone, which will provoke further restrictions. So the 14-day average right now is 4,622 beds, but that number does fluctuate based upon hospital staffing. So we can see that number fluctuate. That number could go up or down depending on what hospitals are reporting. So it really is going to be a combination of both of how many new cases we have versus what the average 14-day average of hospital capacity is. And when we cross that line, then we will hit those additional restrictions that I laid out on Friday. So again, want to highlight people on this. This is a chart that is not available yet on the Department of Health and Human Services website. We are working to make that available later this week. Speaking of later this week, we will have a press conference, press briefing on Thursday at 10:30 a.m. It will be a virtual one. They'll be talking about the kickoff of a communications campaign that is being sponsored by a number of different folks. And then on Friday at 1:30 p.m., we will be having another press briefing. And in that, we will talk about some of the questions that were raised earlier this week with regard to contact tracing. With the increasing number of cases, we have had an increased caseload there, and we'll talk further about the state's response to be able to address that. And so with that, I'm going to go ahead and open it up to questions and answers, starting with the questions that were submitted ahead of time. So taking first from Manette Lokes from the Scottsbluff Herald. Organizers of community events, parades, jogs, and other large gatherings have indicated plans to go forward during the holiday season. Does the governor believe that health districts have the authority to deny these events despite directed health measures not limiting the gatherings, 100% of outside occupation? Well, a couple things I'd say on that. First of all, for any of those large events, you need to go to your public health directors and get sign off by your plan. So they need to approve the plan before you can go forward with that event. So please remember to do that if you're going to have one of those large events. Second of all, I'd ask you to continue to monitor the status of where we are, because if we hit that red zone, those numbers for even outside gatherings will drop to 25, and that may indicate that you are not able to have your event. So you may want to take that into consideration with regard to your planning as well. So please remember that. She also asks, some areas have seen more resistance toward voluntary compliance of mask mandates, social distancing measures, and so forth. How would the governor directly encourage change of heart, so to speak, with these individuals? And again, I think it's a education and communication campaign. It's one of the things that we do every day when we have one of these press briefings. We're talking about the rules around keeping that 6 foot of distance, wearing a mask when you're going to be going to the store, for example, or be inside closer than 6 feet to somebody, washing your hands often, staying home when you're sick, trying to work from home if you can, going to the store once a week, go by yourself. These are all things that we can do to be able to help slow the spread of the virus. And certainly, again, with the Thanksgiving holiday approaching, encourage people to rethink holiday plans to reduce the size of those to make sure that we're slowing the spread of the virus. We've also asked businesses to look how they can de-densify their workplace to have fewer people in the workplace. And that's what we're doing at the state of Nebraska as well. During a call Monday, health officials were asked why child care providers and volunteers are required to wear masks under the current DHM, however, schools are not. What does the governor see as the difference between that requires child care providers to wear masks, however, school teachers, administrators, and so forth are not required to wear masks? And again, it really gets back to that notion of being close to somebody and that close contact. We talk about avoiding the 3 C's, confined spaces, crowded places, and close contact. Well, in a childcare setting, when you're talking about preschoolers, oftentimes the childcare provider will have to be in close contact with that child. If it's a baby, obviously you're going to be holding the baby. That's not the case so much in our schools, where you would have the opportunity to have more distancing, and those young people would be spaced out in the classroom. I know many of our teachers are doing this, and actually expected to stay in that role versus preschoolers who are probably not as likely to be able to do that. So it's really a matter of close contact. I would note, however, I believe almost all of our schools have some form of masking as a part of their overall routine to be able to slow the spread of the virus in our schools, including the social distancing, regular hand washing, and so forth. Our teachers and our educators, our administrators are doing a fantastic job of putting that structure in place in our schools, and we want to thank them for all their work on that. And then let's see. Got a question here from Jeff Van Sant. We are working on a story about health officials at Elkhorn, Logan Valley Health and Douglas County Health Departments who've received death threats and are now under security. Wondering if you've heard anything about this. Certainly, we are aware, and for example, in the Logan Valley, Elkhorn Logan Valley District, I know that the person who made the threats is being prosecuted. And this is again where we ask for that space for grace for everybody just trying to do their job to keep people healthy. When your local public health department calls or makes a determination that you have to quarantine or isolate, that's done to be able to keep you and the rest of the public healthy. So please leave a little space for grace, respect their decisions, respect what they're doing. At Nebraskans, we're about being Nebraska nice to each other. We treat each other with dignity and respect, and we want people to remember that even in these trying times. So please remember to take care of your local public health department as we're going through this pandemic. And if you do cross the line with regard to these types of threats, the law enforcement will be called and you will be prosecuted. And so please remember, folks, it's just not worth it. Please treat your local public health department respectfully and follow their directions. And so with that, Taylor, I think you've got maybe a couple of other questions that came in.
We do. Michael Shively with News Channel Nebraska asks, Beatrice passed a citywide mask requirement today, and Fairbury City Council is considering one tonight. Do you have a message for the city leaders across the state who are passing or considering mask mandates?
Well, again, my position is pretty clear on this. I've been pretty consistent throughout this entire pandemic. I don't think mask mandates are appropriate. I think that they breed resistance. Where we've got them at the state, it's in places where it's very specific. So for example, in those businesses where staff and patron are going to be closer than 6 feet for 15 minutes or more. But of course, for municipalities, for example, who are considering these ordinances, I'd encourage them to check with their legal advisors with regard to their ability to do that, to make sure they're staying in compliance with the law.
Andrew Zaki has a few questions. This first is, how long is it taking for patients going through Nebraska's transfer center to find a bed? Is it getting more difficult?
So Andrew Zaki is asking about the transfer center. I can share a little bit of experience from the call we had this morning where the transfer center was talking about 17 patients and 18 patients that needed transfer yesterday and 17 patients getting done in a fairly quick manner of time. Dr. Antone, I don't know if you want to come up and add anything to that with regard to the transfer center.
The transfer centers turned out to be one of our best partners here so far during this pandemic, and I want to just commend them for the job they're doing. And initially in the spring, the transfer center was set up to help with transfers mainly from critical access hospitals to the major hospitals when the major hospitals had capacity to get those patients transferred in. Here lately, it's been set up to actually distribute the patients somewhat evenly between the regional hospitals where that patient's from, and so they will do their best to find a hospital closest to where that patient is at that point in time to one of the regional hospitals. And if that's not possible, then they go on a rotation basis through the hospitals in that region to go ahead and accept that patient. So it has, as the governor mentioned, increased. The volume has increased for the transfer center quite a bit from maybe only 3 or 4 of these transfers taking place a day up to what he mentioned about 17 or 18 yesterday. So it's definitely a lot of work for those transfer center personnel to do this, but they're doing a great job. And I want to also commend the hospitals that are taking part in this transfer center process.
Andrew also has some questions that might be for you, Dr. Antone. He, before the program started, sending questions about antibody treatments. He wants to know how that could help reduce hospitalizations, how they will be distributed, and which patients will get it.
So right now, our distribution will be based off what hospital systems or infusion centers have the capability of doing this infusion on an outpatient basis. We're exploring the idea, like I mentioned before, of long-term care facilities and even doing some infusions in those long-term care facilities. It's generally recommended at this point in time to prevent hospitalizations in the high-risk populations, such as elderly, greater than age 65, or in high-risk medical groups, such as those with maybe immunosuppression due to whatever reason on immunosuppressive drugs. So this is, it's data showed about 5 to 10% of patients that receive this infusion will have a 5 to 10% less chance of needing that hospitalization. So that adds up after a while. If there's 100 patients that need a hospitalization, that means 5 or 10 will probably not require that hospitalization because of this infusion. Was there something else there, Taylor? Did I miss one of those?
I think you got it.
Okay.
Grant Schulte sent a couple of questions in. His first one is, earlier this year, the governor relaxed some licensing rules for nurses and doctors to try to provide more staffing for Nebraska's hospitals. Do we know how much of a difference that has made, and are those rules still in effect?
So to answer Grant's second question first, those rules still are in effect with regard to the licensing changes we made and some of the requirements that we waived in the statutes. With regard to how many people that is directly impacting, I don't have the answer to that, Grant. We'll have to run that down unless Dr. Antone, do you know how many people that impacted?
I don't know the specific numbers. All I've heard is that it has helped.
Okay, so maybe Grant, Dr. Antone said he's heard it's helped. We don't have numbers, so that's one that we can run down for you and get you an answer on.
And then he wants to know, if the rules have gone back to normal, do you plan to waive them again, which you've already addressed? And then finally, would you consider loosening rules further?
And the question with regard to loosening rules further, certainly I would consider that if somebody came and said there's a compelling reason why we need to do that, and that on balance, it would be in the interest of public safety. So nobody has, to my knowledge, come forward to ask for additional relaxation, but it's certainly something we're willing to consider.
Shannon from KSNB in Hastings asked, what do you think of Grand Island, Hastings, and Kearney city leaders looking to implement mask policies for each city? Will you try to prevent the cities from having the policies?
So I think that kind of the earlier answer I gave for Beatrice is still appropriate here, and just encourage the municipalities to make sure that they're complying with law when they do so.
We've got a few questions from Chris at NTV. Could you please ask the governor what his reaction is to the Iowa governor putting a mask mandate in, as well as his thoughts on the Tri-Cities looking at their own?
So again, folks, one of the things I really want to emphasize here is that masks are just one of the tools that we have. We've often talked about that Swiss cheese layer of things that we do. Masks are not a panacea. They're going to solve all the problems. They need to be used along with our other tools as part of that Swiss cheese strategy. So here in Nebraska, we've implemented masks, for example, in businesses, we're going to be staff and patrons are going to be closer than 6 feet for 15 minutes as part of that Swiss cheese strategy. But also the other restrictions that we put in place with regard to limiting the size of gatherings, the restrictions we put in place with regard to restaurants and bars and all those sort of things. So it needs to be used alongside of all of those, plus the things we talk about with regard to staying home when you're sick, making sure that you're going to the store once a week and going by yourself, work from home if you can. The things we talk about with regard to washing your hands and making sure you keep that 6 foot distance. All these things go together along with avoiding the 3 Cs that will be that Swiss cheese layer that will help us slow the spread of virus here in our state. So masks are a tool. They're not the only tool. They have to be used in conjunction with everything else.
Chris also asks, how will a mask mandate negatively affect businesses? What are the repercussions of a mask mandate versus no mask mandate? Are people simply uncomfortable, or are people dead because there's no mask mandate?
Well, again, masks are one of the tools we use, but they're not the only tool, and they're not going to be something by themselves that are going to be effective. We have to learn to use all the tools that we have. And the other thing that I want to remind people is that even with the really good news we've had this week with regard to, say, Moderna's vaccine, it is going to take time for these vaccines to produce in numbers to make them widely available to the public. We are going to have a priority order that I discussed around healthcare workers and long-term care workers and first responders and so forth. And so those were the folks getting it first, which means that everybody else is going to have to continue to work on our tools that we have, that Swiss cheese. That includes keeping that 6 foot distance, wearing a mask, washing your hands, avoiding the 3 Cs, staying home when you're sick, trying to work from home if you can, go to the store once a week. All these sorts of things are the things that will be that Swiss cheese that help us protect us and slow down the spread of the virus. So it's all these things that have to work together, and we have to learn to use all of our tools and use them for the next several months as we see the vaccine comes out and gets ramped up.
And then you may have already answered this, Dr. Antone, but Chris sent a message asking how soon the antibody treatment will be available to hospitals and long-term care facilities.
It should be out this week.
And the answer from Dr. Antone is that it should be out this week. Martha has a question. How many cases have been traced to the Trump rally just before Election Day?
To my knowledge, there have been no cases traced to the Trump rally that I know of, but Dr. Antone, perhaps you've got more information on that than I do.
I do not have any other information besides that. That's all I know. As far as I know, there's been none.
And Dr. Antone states that he has no other information about cases being traced back to that event. Becca Costello says there's a photo circulating on social media showing you, Governor, posing for a photo with other people with indoors with no masks on. What is your response to the criticism that this violates the 3 Cs?
So again, it's about learning to use our tools properly. Generally, you've got a close contact when you are within somebody of 6 feet for 15 minutes or more. So oftentimes when I'm taking a picture, certainly at the, whatever the preference is for the person who's getting the picture taken, offer to remove my mask while we take the picture and then put it back on again when we're done taking the pictures.
We have a question from Tom Becca. He says, doctors and nurses and teachers are some of your constituents who are asking for a mask mandate and tougher restrictions. Who are the constituents you are listening to that are against the mask mandate and tighter restrictions?
Well, again, traveling the state, talk to people all across the state with regard to it. And if Tom is looking for examples of people who are opposed to it, Omaha City Council meeting, I think there was some a group that was actually looking to protest this, which I'm thankful did not happen. But I think there's plenty of examples along those lines as well. And again, just remind Tom that with regard to how we're implementing all of our tools, masks are just one. They're not the only thing that are going to help us slow down the spread of the virus. It needs to be used along with all of our other tools. And we're using masks in places where it makes sense, like in businesses where the staff and patrons are closer than 6 feet for 15 minutes or more, as a great example of where we should be using masks.
Doug Duda from KKPR in Kearney asks, if there's a mask mandate, would it be necessary to close any businesses, including those considered non-essential, since they're already using masks?
So with regard to essential versus non-essential, that's not a distinction that we make here in Nebraska. You may recall that we were one of the states that did not do a stay-at-home order, and therefore we did not make that distinction between essential and non-essential businesses here in our state. With regard to, again, wearing masks, if you've got customers that are going to be closer to your staff for 15 minutes or more, both parties should be wearing masks.
And then we have another question from Chris at NTV for Dr. Antone. I've heard 1,000 doses, that we are only getting 1,000 doses of the new antibody treatment coming to Nebraska. Is this really enough considering our population is much higher, and what are the priorities for distribution?
So as far as the number of doses of the monoclonal antibody coming into Nebraska, I don't know the specific number that are coming in, but I know when the survey went out to the places that wanted to receive it and had the means to go ahead and infuse it, that those facilities and the request for the number of doses exceeded the amount that we were going to be allocated. I can't tell you the specific numbers right now, but it will be distributed, like we say, on that basis of elderly and high-risk patients that would benefit the most from needing hospitalizations.
Thank you, Dr. Antone. Questions from here in the room? Paul?
I don't know, maybe I missed your answer, but what is your reaction to the governor of Iowa issuing this kind of a partial mask mandate to people need to wear masks when they come to a state building and go to a funeral or a wedding? What is your reaction to her step that she took?
Yeah, so that Paul was asking a question about my reaction to the Iowa governor's rules that she's put in place, including what she's doing with regard to masks. And in general, every state has been taking a different approach to how they're managing the pandemic. That is appropriate, given that every state is different. And so I'm sure the Iowa governor, I've not talked to her directly about this, but I'm sure she's doing what she thinks is the best to be able to manage the pandemic in Iowa. And that's what we've been doing here in Nebraska as well.
Another question, I looked up some past stories. And before Nebraska passed the seatbelt law, only 30% of drivers in Nebraska were wearing seatbelts. But just a few months after the law went into effect, it went up to 53%. Given that increase and the effectiveness of that mandate, don't you think it just makes common sense to do that with masks in Nebraska to reduce the spread, reduce fatality?
Well, I think one of the differences between the masks and the seatbelts you described there, Paul, is that masks are just one of the tools that we have to be able to slow it. There's a lot more things that have to work. And again, you can look at states like Wisconsin, who have very high case counts. They've had a mask mandate in since August 1st. So we need actually all of our tools to be used to be able to be effective response in slowing this virus down versus something like a seatbelt, which again, lots of data behind that for years that show that that will make a dramatic impact when you have an accident in reducing the harm that you have and so forth. So I don't think they're actually apples to apples comparisons there, given that there's so many things that actually have to come together to be able to slow the spread of the virus. Again, masks are an important tool, they work, but they're not the only tool.
What about, and I wasn't clear, I mean, earlier this year when some counties were talking about doing mask mandates, you said, well, they're not going to get any CARES Act money.
I'm sorry, can you say that again, Paul, please?
Earlier this year, you had a problem with some local governments and said they wouldn't get CARES Act money if they enacted a mask mandate. Are you saying now you wouldn't do anything like that, or are you saying now you might take action like that?
Well, Paul, I think you're misremembering what happened earlier this year. So what we said earlier this year was that counties, county courthouses who prevented people from getting the state services that are provided through county courthouses because of refusing somebody to wear a mask were the ones who weren't going to get the CARES Act. It was not a broad mandate to the county, and it was not included in cities or anything like that. It was specifically about preventing state services from being provided. So again, it wasn't the broad-based thing I think you're describing there.
But you took action then. Would you take action now against cities that enact a mask mandate?
Well, it's kind of a moot point, Paul. Again, if cities are acting within their lawful rights, they have to, again, consult their legal advisors with regard to that. If they're behaving within the law, then we're not going to interfere with that. Frankly, most of the CARES Act money has already been distributed or is already been earmarked to be distributed.
But are you seeking a legal opinion to find out if they're clearly able to do that?
We have not contacted the AG about a legal opinion for other municipalities at this point.
Other questions?
Well, I was going to ask that. Why not?
Why not what, Fred?
Why not ask the AG if there's a legal question as to whether cities can do this? He's your legal advisor, right?
We may, Fred, we just have not, Paul asked if we had done it. We have not done it yet. We may in the future. We just haven't gotten that far yet.
Other questions? Paul?
On these transfers, is it clear they're finding enough beds right now, or are they having any trouble finding a bed when they transfer?
Dr. Antone, you want to come up?
So if that transfer, the question is are they having trouble finding beds? The transfer center now that hospitals are filling capacity a little bit more than they did in the spring specifically, obviously. And the question is if that hospital is in that rotation to take that patient, they will find a bed for that patient.
Where is this transfer center?
It's actually located, well, it's run from the CHI, had their own transfer center set up for all their series of hospitals throughout the state. It's actually physically located in Omaha and used to be run by one or two of the staff there, but they've actually increased their staff to help with this.
And are there any hospitals that are at capacity?
There are some hospitals that might not have the the capacity to take maybe an ICU patient or something of that nature, but they will find a bed for that patient.
In that hospital?
Not in that hospital, but in another hospital. If they don't have that capacity in the ICU to staff that ICU, then they'll find one in that area or transfer outside that area as needed. So far, to my knowledge, no patient that's used the transfer center has been denied a bed.
While you're up there, can I just ask, we're talking about vitamin D. Can you put that in English? I mean, how much vitamin D do you need? Is that 200 micrograms?
So the question is about how much vitamin D is necessary. So back in the days when the dose for vitamin D, the recommended daily allowance for vitamin D was made, it was to prevent a disease called Ricketts, and they found that 400 international units a day was enough for that. Sorry, Governor.
Yeah, I was gonna say, really, Gary, you had to do that, really?
Which was a calcium metabolism bone type disease, and it was found that 400 international units was actually enough to prevent that disease process. But now we know that the level for vitamin D that was set for the normal is now being reset higher because we know vitamin D has a lot more benefits than just preventing that disease, that bone disease.
So how many of those little white pills do we have to take to be able to get to the, I think you said 4,000 international?
Yeah, I
units
mean,
or
the surgery I used to do had as a side effect making patients vitamin D deficient. So I had a lot of experience with this in the background for my type of surgery. And it used to be that vitamin D was not very easily found as an over-the-counter dose. But about 5 or 10 years ago, the manufacturers found a way to make vitamin D in higher doses so that now you can go to like a retailer, let's say one of the major retailers like Costco or Sam's that sells in bulk, and you can get a 5,000 unit international unit tablet, which is obviously more than 10 times the recommended daily allowance, for less than $20 for a year's supply.
So is an international unit the same as a milligram?
No, it is not. An international unit is a different way of measurement.
How many milligrams is?
I don't know that milligram dose as far as the calcium translation.
It sounded like you were recommending that the general population gear up with vitamin D. Is that right?
I know a lot of people that are doing that as a routine now, and especially the latitude that we used to use was north of the Kansas City latitude. You can pretty much guarantee that the UV light that changes that inactive form of vitamin D to the active form will not be enough to keep your vitamin D normal. As a matter of fact, about 40% of the general population in the United States has vitamin D deficiency.
Dr. Anton, Martha Stoddard had a follow-up question on vitamin D. Can you take too much vitamin D?
There's really not a whole lot of toxicity to vitamin D unless you are prone to developing kidney or renal stones. And that way, maybe there could be a side effect of developing more stones if they're calcium oxalate related, those stones. That's the only side effect I know for vitamin D toxicity.
Any other questions? Paul has another question.
Did the governor lose a bet with the governor of Illinois, because he's dressed in the colors of the University of Illinois, who Nebraska's playing this week?
Oh, you know what, Paul? It must just be the camera. This is a red tie, not an orange tie.
It is, looks orange.
Here, hold on. So let me turn off this light, see if that helps. Does that make it look more red?
It did a little bit, yep, yep. Any final questions? All right, well, thank you all. Governor, did you have any final comments?
Again, we just want to encourage folks to rethink their Thanksgiving Day holiday plans and go to the smaller groups, maybe get with the larger group via Zoom, to be able to slow the spread of the virus. And of course, continue to remember to watch your distance, keep that 6 foot of distance when you're in public, wear a mask when you go to the store, wash your hands often, and avoid the 3 C's. These are all things that will help us slow down the spread of the virus. And please, 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 if you are sick, stay home. Even if you haven't been tested for coronavirus, we don't want to take the risk if that's what you have and you spread it to somebody else. So please stay home when you're sick. With that, Taylor, again, we've got the press briefing at 10:30 on Thursday with the new communications campaign and 1:30 p.m. on Friday talking about contact tracing.
Thank you very much.
Thanks very much.